Well, greetings, everybody. My name is Jared Pigeon. He, him pronouns, serve as the diversity officer here at Minnesota State University Moorhead. And today we have the honor of presenting as a racial and ethnic disparities within COVID-19 in higher education, our work group. So, like with any good team, the team members are very valuable and very important. As we've moved through this process, we've been very collaborative in nature. You can go to the next slide, please. And as you can see, the list on the screen here represents 2-year colleges, 4-year colleges, public, private, for-profit, nonprofit, as well as additional support from the Minnesota Office of Higher Education and the Minnesota Department of Health. This is a very intentional collaboration, and I want to give a big shout out to our work group members and our conveners, Jesse and Leah. Thank you. Next slide, please. The goal of our work group has been trifold. We've reviewed literature that exists on ethnic and racial disparities that exist during COVID-19. We've considered the foundations of disease prevention and transmission, just to recenter us in the definition of health disparities as the Center for Disease and Control defines health disparities as the preventable differences in the burden of disease, injury, violence, or in opportunities to achieve optimal health experience by socially disadvantaged racial, ethnic, and other population groups and communities. Another part of the charge of our work group was to develop and share innovative solutions responding to the uniqueness of higher education. We were to develop a comprehensive list of strategies that higher education, specifically right here in Minnesota, could choose to adapt and meet their needs. And these strategies would be reviewed by multiple people, including the Minnesota Department of Health. One of the main goals in which we wanted to achieve was campus-wide conversations with higher education representatives to empower them to own the planning on their institutions and within their environments and localize the approach in which the strategies lend themselves. So just an update on where we are. We formed early this fall. Many of you remember the student webinar in which we will hear from some results in October 2020. We then moved into the spring, and then we conducted a larger survey across the landscape of higher education within Minnesota to identify practices that were happening on the campus. We reviewed literature that was out there. As you will hear, there was some limitations as COVID-19 has just sprang on us, and many of our states have just jumped into action. March and April, we compiled information from the survey and literature review, and we find ourselves here today presenting this webinar and some best practices. So with that, I'd like to turn it over to one of our work group members, Angie Whitty.
Thanks, Jared. Good afternoon, everyone. My name is Angie Whitty. I work in Multicultural Student Services at St. Cloud State University, and I am here to give you a summary of the webinar and survey results. So this past fall, on October 6th, our work group hosted a webinar with 8 student panelists. They represented 2-year, 4-year public and private institutions. The communities they come from are Indigenous, immigrant, students with disabilities, non-traditional students raising children, and students of color. The questions for the panelists focused on 3 areas: personal impact, external community, and institutional impact. Some of the new and surprising information that was learned from that webinar and panel discussion with the students was that, of course, it was good to hear firsthand accounts from the students about their experience and learning some of the ways that students navigated challenging situations that they were facing, such as various family responsibilities, instructor challenges, different abilities, and accommodations. And it was important to hear that while students are facing a variety of challenges, the connection with their college community and the relationships they build are critical for their success. Regarding race and ethnic disparities due to COVID, some of the comments from campuses across the state were that campuses were more open to discussions within their work teams of the demands of COVID. Folks have been reading articles about vaccine acceptance and uptake differences and thinking about access barriers to testing, the ability to change grading scales for all students, especially with more students of color identifying as first-generation Pell eligible and or low income and needing to work. Students may not be learning their options or have the time to chat with different folks or offices about the options and the impact and consequences of those options. Someone identified their campus budgeted for a new position, a diversity officer, and another comment notes that discussions about racial and ethnic disparities are included into most, if not all, major initiative discussions. Lastly, items that were suggested for us for further explanation were the limitation faced by ethnic minority students, particularly international students, in terms of access to healthcare. Where are students getting their support? Is it direct, housing associations, city, county, federal, state? In what ways? Is it money? Is it housing referrals? Is it food? So really what and how are they getting their support? And then lastly, what actions have proven helpful for others that we may adopt in Minnesota? And then a bibliography of research may also be helpful. Next is Cindy.
Thank you, Angie. So I'm Cindy Hakala. I am with the Minnesota Department of Health, and I've been an MDH liaison to this work group. And I'm going to talk in detail about some of the work we've been doing this spring, the large February survey, and a bit about our lit review. Next slide, please. So in February, the work group sent out a survey on COVID-19 racial and ethnic disparities in higher ed. We had 146 responses, and the audience was, the intended audience was presidents, senior academic officers, senior student affair officers, and senior diversity officers. And the goal of the survey was to further understand the impact of the global pandemic on the gap that marginalized groups have experienced within higher ed, what is being done on campuses to address disparities, and what we can do collectively to help these students during this time. Next slide, please. So I have a few demographic slides to show you. This first one is showing the race and age of students on campuses. So note these are the race and age of students on campus, not the respondents themselves. The respondents were giving us a picture of their campus body. So one thing to note is that we had about 50% of the respondents left these questions blank. So we don't have a full picture, but you can see that maybe unsurprisingly, the majority of students are white, and then the age is majority 21 years or younger. Next slide, please. We also asked about the type of institution that these folks were representing. So we asked about 4-year or 2-year college, and that was about 50 for both types of college. And then again, we had some no responses. We asked about enrollment, and we had quite a smattering of sizes of schools. And we asked about the type of higher ed. So a majority of state schools, but also some private nonprofit and a few private for-profit. Next slide, please. And this is our last demographics slide about the location. So we asked about region and then also about the setting of the campus. So large numbers of respondents were from the Metro and the Northwest, and we're also mostly from urban locations, but we did have some representation from all over. Next slide, please. So we asked 4 open-ended survey questions. Question 1, what gaps have you seen within your institution in marginalized groups? And we gave some examples of what that might be. Question 2, what is your college or university doing on your campuses to address disparities? Question 3, what do you suggest we do as a higher education community to collectively address disparities brought on by the COVID-19 pandemic? We gave examples. And question 4, in what ways can the state of Minnesota support the higher education community in assisting marginalized groups? Next slide, please. So from these open-ended questions, we discovered some themes that were coming up again and again, and we identified them and coded them. And there were 13 themes. And again, respondents were asked 4 different questions. So sometimes the theme came up in more than one question for the same respondent. So that's why there are more mentions of these themes than numbers of respondents. So the themes that were mentioned the most times were funding and financial hardships, access to technology, which could be laptops, internet, cell phone hotspots, that kind of thing, food access, both food insecurity and things like the availability or not of food pantries. And the other ones are healthcare, childcare and caretaking, housing, workplace that included either loss of employment or sometimes respondents mentioned that work study, they were having trouble getting students work study away from campus. Academic, that was sometimes respondents mentioned being able to go a little easier or having some flexibility on their students to reflect the hardships that they were seeing, family and home, transportation, vaccine, a knowledge gap regarding systemic racism, and students facing racism. Next slide, please. So this is a Sankey diagram. I realize it's small and kind of busy, but I wanted to show it to note the interplay between the themes and the responses. In this diagram, they're called cases. So the themes are on the left and the cases are on the right. And you can just see how many cases cited quite a few themes in their responses, and these themes crossed over to many different cases. Next slide, please. So here is the same diagram, only zoomed in, and I just highlighted with these red circles, again, the top 3 responses that we had, which were access to technology, funding and financial hardships, and food access. So you can just see how sort of broadly these crossed over with all the respondents. Next slide, please. And then I wanted to highlight a few of the themes so you could get more of a sense of what information came out of this. And these answers are paraphrased. So one of the responses that we saw a bit was internet access to do online coursework is poor to non-existent in many areas that we serve, which includes cell service for hotspots. So not only was broadband not an option, but cell service for 4G or 5G in order to do assignments was not possible either. And respondents said, we need free universal high-speed internet in all communities and rural areas of Minnesota. And along those lines, respondents had talked about that they loaned laptops, but there was no internet connection at home to use the laptops. So it wasn't a very good solution. Next slide, please. Another theme I wanted to highlight was family and home. So respondents said, students must work to provide for their family, risking exposure, which leads to mental and physical health issues. And another response was providing for family can include caring for younger siblings so that parents can work on the other big issues, but then this takes students away from their studies. Next slide, please. Another theme was the knowledge gap regarding systemic racism. So there's some pretty strong language here. And while these responses didn't answer the survey questions, which were again, what gaps or resources have students in higher ed faced, but we thought they were still important to note. And we want to give some context around this. So some respondents challenged the idea of focusing on groups that have been disproportionately impacted by COVID, including Black communities, Indigenous communities, and communities of color. This is a common question or issue that comes up when discussing equity, but it's important to note that the COVID pandemic has worsened existing inequities and highlighted the gaps in our systems that leave many students and communities behind. And later on, we've included a slide that has links to this data. And it's worsened existing inequities in part because Black, Indigenous, and people of color Minnesotans have some of the greatest exposure to COVID because they are more likely to work in industries considered essential, such as healthcare, and are less likely to be in jobs that allow them to work from home. And if you're not familiar with the definitions of systemic racism, we will have provided that resource, and we have links to materials later on that can help further explain these concepts. And I'll go over the themes now. So some people said stop treating some groups differently than others. Calling certain groups marginalized promotes failure. Everyone should be treated equally. Don't give special treatment because of skin color. And too much is already being done for marginalized groups, making things unfair for others. And I also want to note on this slide that some respondents made the good point that we should emphasize community strengths, not weaknesses. And our Black, Indigenous, and people of color students are drawing on many community assets and championing community-led solutions to longstanding inequities. Next slide, please. So here's another Sankey diagram, and this is another close-up regarding the theme of the gap in knowledge of systemic racism. And I think it's interesting to note, if you look in the red circle, that the cases that responded in a way that showed a lack of knowledge regarding systemic racism also nearly uniformly did not mention any of the challenges to students that the other respondents did. Next slide, please. And the last theme I wanted to highlight was the theme of resources. So some respondents said lists of resources and grants available to address education, food insecurity, access to technology, etc., should be shared amongst institutions. And in this, they meant to a greater degree than what's happening now. And also, we should be asking our students what they need. And this theme had some of the most original and interesting responses. Many talked about sharing resources throughout the state and amongst higher ed, and changes needed at the state or federal level. Next slide, please. Other things we learned. Many sectors where BIPOC students are experiencing hardships. And again, to go over some of those main themes, they included financial, technology, food, healthcare, childcare, housing, and employment. So just many sectors of everyday life. The lack of diverse staff and faculty is a problem. Respondents said that higher education needs to have more diverse faculty and staff to work with BIPOC students who can understand and relate to their experiences more easily. Several respondents mentioned needing to start with K-12 education to help students be successful in higher ed. And mental health was a big part of the healthcare theme. And I want to note that many schools have made great efforts to provide emergency funds, food banks, technology, childcare, etc. for their students. I wanted to say thank you so much to everyone who responded to our survey for your time and insights. Next slide, please. A little bit about the literature review. This document will be posted on SharePoint. There was kind of a small body of literature to pull from. It's a new field. There's not much for peer-reviewed research yet, specifically regarding higher ed and disparities and COVID. But what we did find showed a lot of similarities to both the webinar survey and our February survey. That a lack of access to internet and technology is an issue, mental health concerns are an issue, and that the pandemic exacerbates existing problems. Next slide, please. And as I said earlier, here are some resources for exploring the roots and trends in inequities. So there is a video on what is systemic racism and how did it come about, and data from Minnesota on COVID-related data by race and ethnicity. And I want to thank the work group for letting me be involved and trusting me with this data. It is such an incredible group to be a part of. And now we will hear from Dr. Jesse Mason, who will talk about best practices.
Good afternoon, everyone. So what can we do next? But first, again, I wanted to kind of echo what Cindy said, and thanks for all the research and your help on this, Cindy. This has been a great group who's been passionate and committed in understanding of not only the approach, but who really embodied what student-centeredness. They've been a motivation to me in their efforts on their campuses and their efforts in this work. I also wanted to follow up on some of the other things from the research before I get to the best practices, especially when we talk about health disparities. And when we talk about systemic racism, because the underlying cause of health disparities and educational disparities include some of the same things as Cindy said: systemic racism, blatant discrimination from the history of science that has even compelled today when we talk about research and when research is done and who it's done to, socioeconomic status, and lack of access to quality health and educational resources from K-12 through et cetera, and how our tax laws. And so when we talk about just talking about these disparities due to COVID, it only made worse. And when we talk about marginalized individuals, we're not talking that they are marginal. It is how the systems that have been in place to create the marginalization and further relegate them in a number of areas and spaces historically. And so as we navigate COVID, we're also seeing an increase of what has always been there historically. And as Cindy said, some of the worst cases are in Minnesota. So we beg you to look at it more from a lens of equity and understanding rather than justification, which normally lead to, in the perception of a person of color, is maintaining the status quo and politicizing the experiences of those who continue to be traumatized every day. Next slide, please. So some of the best practices that we found in both some of the research that Cindy was great in leading, and what the group found is create networks between campus healthcare providers, county, city, and MDH to provide quality healthcare access. And that involves not only working with MDH, but the county and working with churches, different other central cultural centers that may not only educate, but provide that quality health care to individuals in the community. Open campus food board with transparent hours and create sign-in for pickups. Also, when grants are available, as North Hennepin did, we had volunteers drive and drop off safely food to families' homes that were a great help to many of the students that were either on quarantine and couldn't work or no longer could do student work, or whose family members had lost their jobs as well. Next slide. Educate those who serve our student population, because as we know, even in the political quandary that we find ourselves in, our faculty and staff and students represent what's in the community and some of the divisiveness, especially when it comes to differences in health outcomes and how that impacts academics. A recent article came out in Inside Higher Ed in reference to a lot of students drop off because of life, and how COVID has really kind of fortified or made it worse. And so those are the kind of decisions. It's not because academics and not because they're not intelligent or prepared or resilient. It is a continual decision making in reference to how do they survive in academia when there's so many other social issues, such as and other issues in their lives, such as homelessness and joblessness. We also found the best practices is to create a plan online and alternative methods and modalities for teaching. And that is really being responsive to students and students' needs and what will best particularly work for them so they can continue to their journey in increasing their social mobility and being able to work. Some examples is expanding Wi-Fi to parking lots, working with local government and libraries to expand access and affordability to not only the Wi-Fi, but also getting internet, and what does that mean for them. And also, I would say, not just for this period of time, as we hopefully soon will be out of COVID, but how do we extend that to make it more consistent and build capacity around the digital gap that are facing especially marginalized groups. Next slide. Also, continue to receive input from students. And this should really be a consultation, a partnership, a true partnership between students, employees, and community members. And look at the stratified data. I know a lot of people sometimes get concerned when we stratify the data and break it down by gender in its intersection with ethnicity and race, and prioritize solutions and interventions. Again, through that partnership, that can be focus groups, engage partners, not only like the city or the county or MDH, but engage affinity partners who serve particular communities and have a better idea in reference to how to serve and some of the barriers. And also build an accountability structure. How do you know that you are serving the students that you intend to serve, rather than doing a one-size model and just looking at generalized data and not seeing those who are being continuously underserved. Continue to service low-income or housing insecure students in the following areas, such as working with local county entities and nonprofits around housing. How do we increase dining services or have dining services available? A lot of the students that mentioned in the webinar also talked about laundry room and having to do laundry, and transportation, especially living in places where there's not a lot of public or efficient public transportation. Next slide, please. Finally, next is prioritize student needs and target priority. I know in some of the literature it says randomize, and I had a problem with the randomization because that means not being proactive or strategically serving the students who need more emergency aid. In reference to also that working with your foundation and that emergency aid grants that they particularly have, and fundraising can be a source of that to help mitigate some of the impact that COVID has caused our marginalized students. Provide accessible resources and adequate medical care by drop-in and viral care option. Leverage relationship with community and government agency for culturally informed and evidence-based practice to serve the students' need. Continue in creative ways that also meet the criteria for the U.S. Department of Education for students to continue to do their work study jobs. I know at North Hennepin, we found some way that students could still do their particular jobs in many cases, even remote to a degree. And so continue to work with financial aid to meet those criteria and find the ways to keep those students employed. Next slide, please. And again, thank you. And we're open for questions. Hopefully we'll have the written document available sooner and later. This has been, again, a great group to work with, and I look forward to continuing to work with them as we try to make a better life for all people here in Minnesota. Thank you.
Michaela, do we have any questions?
We do not. Just a lot of people saying thank you and what a great presentation this was.
Well, I will go on to kind of the odds and ends portion of this, but as people are processing, I know this is a lot to process, and it was such a great presentation. Thank you to the entire work group for this. I think it's such an important topic and one that we should continue to revisit. But as people kind of think through everything here, please put your questions in the chat, and also know that if you have questions afterwards, we can connect you with all the right folks, and all the resources and materials will also get posted on SharePoint. Thank you again.